So if she has pain near her patellar tendon, we can put almost like, you know, those CHOPAT braces. Have you seen those? Whether it's for an elbow or for the patellar tendon, you can do a piece across as if it was a CHOPAT strap. We'll assume she has some IT band tension. Yeah. So we can put a piece up through there to mobilize that area. Dependent on the person, if they do have a weak quad, we can put another piece around. So I'm going to show you like kind of my standard way. I tend to do it for a lot of common knee conditions. And then for her, we can add a piece across. All right, so, so again, if there's hair, you want to trim it and get their consent. And then best practice is to use rubbing alcohol. If you don't have rubbing alcohol, hand sanitizer can work too. That doesn't have like moisturizer in it. Okay, so we're just gonna rub alcohol you to get the oils and lotion off of you. What color? Do you want blue? Well, actually, we'll use blue because the, or beige. I have beige in my bag.
No, black.
I don't want to, oh, we can use part black because those ones are pre-cut, so I'm going to show you without them being pre-cut. Alright, so we'll use some blue and some black. Alright. So you just you like measure up. Usually want to go at least 1/3 up the thigh. Okay, you could keep going depending on if her IT band was really tight. So, but you just want to kind of measure where you want it and cut it a little shorter than what you think because the tape is stretchy. All right. And then they have special kinesio taping scissors that work really nice, but they're like, I don't know, $100.
Of course.
Yeah.
Scissors?
Yeah. Yeah.
If you take a class, sometimes they give you free scissors, which is
Yeah.
really nice.
Yeah,
Oh, yes. But if you work for the right company, they
And
pay for
then we could use this to go across if you want some.
Hopefully I find a job for $3.99.
So some of these are
it. So you
pre-cut.
just have your husband get them. $3.99.
You want to avoid getting in the popliteal crease or fossa. And then you want to round the edges just so it doesn't roll off as easily. And those are, it's already rounded on the other side. And we can explain to them while we're cutting the tape what this is going to do. This is going to rub your area of pain to reduce pain with movement. If you have swelling, we'll pretend your knee is swollen. It can also reduce your swelling by increasing and lifting the skin and improving lymphatic and blood flow. Okay, and by putting it on your muscle, it can make it test stronger for longer. So with your patients, like when you practice on each other, do like a comparable sign for time constraints here. For me showing all these different spots, we're not gonna do it, but like for her, she could squat, she could jump, do something that will irritate her to then tape her, and then repeat that sign and see if there's a difference. You can have her rate her pain 0 to 10 while she's doing that. All right, so we're good. And this one, I think I had it over here. Okay. So you want the tissue on stretch. So for the knee, sitting is perfect, like this. You don't want them on end range. You want them a little more than half of the range. And so you just take about 2 inches of the tape and rip the paper backing off. And if she's having patellar tendon pain, you want to go about 1 inch distal and lay it down. And then you go and take the rest of it off, other than leave a tab so your finger doesn't stick on it. And that's where you can play around with the stretch, 100%, 50%, right? So for most conditions that don't have any significant swelling, 50% is acceptable, but I gave you that slide that showed other percentages, okay? But 50%, we wrap it here in her quad, no stretch, I just lay it down, okay?
That was smooth.
Thank you. We create lots of garbage here, so, right? Rip 2 inches, right? Her IT band comes down here. We anchor it down. You want to avoid tape on tape. It's going to come off easier. Okay, give it that, not 100, 50%. Come along her patella, going towards her hip. And then we can take this piece. You want to make sure, I'm going to cut it a little too short. I'm going to cut it a little longer. You want to go skin on skin so it sticks better. Like that. So cut a little bit. When I kinesiotape people, you could document it under therapeutic exercise. You could put it under neuromuscular reeducation if their muscle is weak. There are taping codes you can use too, but I don't really use those. Okay, so we get it on, right? Get it on her skin. Give that 50% stretch. 100%, 50. And then it's heat activated, so that's why we're gonna rub it when we're done. If you have a hair dryer, you could heat it on low. That's why I remind everyone, leave this on. It should last at least 2 to 3 days. Keep it as long as it will stay. If it really is coming off and you rub it, heat it, you can trim it. And even if half of it's on, it will still help. Only take it off when it's wet. Just like a Band-Aid, you rip it off dry, it may irritate your skin. Okay. Okay.